Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Types of euthanasia: active euthanasia and passive euthanasia. Active euthanasia. Active euthanasia is act of commission. For example, give high doses of morphine and kill the patient. So in active euthanasia in India, active euthanasia is not legalized and the doctor can be charged for murder under 302 IPC for active euthanasia. Passive euthanasia. In passive euthanasia, discontinue giving treatment and or not using extraordinary methods of survival is passive euthanasia. In India, passive euthanasia is legalized in 11th March 2011 in Aruna Shamba case. Passive euthanasia is legalized under two conditions. One, when the person is in persistently vegetative state, that is, cerebral cortex is damaged and the patient is unconscious and there is no chance of coming into consciousness. Gradual withdrawal of nutrients and treatment is allowed in passive euthanasia. In case of brain death, that is brainstem death, and none of the reflexes are present, then passive euthanasia can be done by removing the support system.
thank you and thank you for watching.